Eu acho melhor ir ter vocês que vão participar, sentem para cá e vai servir para lá poder captar melhor o áudio. Dá uma invertida, tá bom?
Eu de passar, então a gente passa. Só para ter a minha filha.
E se a Janine está te ouvindo bem?
Janine, can you hear us well?
Deixa eu ligar o microfone.
Yes, I can hear you. Sorry, I was muted.
To change the venue, so yeah, out of our environment here. Yeah, copying the presentations to because you are in another building, so
So perhaps I can watch on the YouTube live the presentation.
yeah, just copying to this computer because they are not
okay.
at the main building. We have to change the venue, so acquainted with the equipment and such. So
okay.
we're having some technical troubles here.
Yeah, I told my students as well to listen, so I think a couple of them are online as well, so that's good. But otherwise, you guys are doing fine. It's still warm in Rio. In Cape Town, it's very cold.
So quite cold, actually. It should be warm enough by now, but it's been very cold.
Okay.
Cadê a apresentação?
Está copiando.
Eu compartilhei com eles. Aí talvez não deles, eles compartilhar deles. É um dos sócios de University Farmer no House. Compartilhar.
Depois, peço para um minutinho para ver se tem perguntas.
Já estamos assistindo já, tá?
Não?
Já estamos olhando no YouTube já.
Já falou? Não, eu acompanhar para ver.
Só que eu não vou ter que ficar, não.
Você tem que ficar.
Eu tenho que deixar os meninos na escola. Pode as meninas que acompanham, se tem alguma questão no YouTube. Mas elas. Vou desativar, peraí.
Really?
Ele estava falando e você não.
Really?
Hi.
Yeah, I just introduced the session, but I had issue with the microphone. I talked about this partnership of ours that we started a few years ago, and this workshop is a follow-up from follow-up to our previous visit to IMS-UERJ. And I invited you to present yourself, introduce yourself in your parts over there. Sorry for the closed mic.
No, it's fine. I'm Janine Wichman at the School of Health Systems and Public Health from the University of Pretoria. I'm a full professor at the University of Pretoria. I made contact with Washington a couple of years ago, and then we started working together. He also co-supervised a PhD student of mine. And then last year, you invited me to join you in Rio. So it was nice to be over there as well and to start talking how we can collaborate. And now it's actually so nice that I see my two colleagues sitting there as well. So they came from Chile, and then en route back to South Africa, they paid you a visit as well. So Professor Joyce Shirindi will give a talk. Her focus is on health promotion, air pollution, climate change, working specifically in research areas, remote research areas that are mostly neglected sometimes. And then Dr. Sean Patrick, he's also very active in conducting studies in climate change, also looking at prostate cancer, so chronic diseases, malaria as well. I'm sure you will enjoy their presentations. And I have a couple of postgrad students from the University of Pretoria also online, and I invited people from Zambia, Zimbabwe, Mozambique, and Namibia also to join. So it's quite a diverse group of people, but I think it will be a very nice session. So over to you, Washington. Thank you for the organization.
Thank you, Lynn. Well, the presenting speakers will be Beatriz de Oliveira. We have this partnership as well. We work together for a long time. She have been working with pollution and climate change as well. And Tatiana Moraes is our latest acquisition in the department. She's also working with the climate change, and maybe you can talk a little bit more about yourself. Without further ado, Janine, I thought the format would be you call Joyce and Sean, and I call Beatriz and Tatiana. Introduce the title of the presentations.
Let me get it up again.
Is it okay?
Yeah. I'm just looking at what the title is. So the first speaker is Prof. Joyce Shirindi with the title of Navigating Environmental Epidemiology Research in the Global South and Challenges of Working in Rural and Underserved Communities. And then followed by Beatrice will then speak, and then Dr. Sean Patrick will speak on bridging knowledge gaps and addressing emerging threats in the Global South.
Joyce.
Another Joyce?
Oui, oui, yes, sir.
Give. Mike Martin Talashia.
Control. Yeah.
Good morning, everyone, and thanks for welcoming us in Brazil, in the country. As Janine has already mentioned, I'm Joyce from the School of Health Systems in Africa. I'm an assistant professor here. And it's a privilege to be given this. Thank you. So I'll just go straight into the presentation. My talk today is going to be mainly on challenges of working in rural and underserved communities in the global south. Okay, so my talk will also be based on the next slide. Yes. My talk will be based on South Africa, but these challenges apply in many other countries as well. So in South Africa, we have a population of about 60 million people in different provinces. And then the life expectancy currently is about 64 years. Majority of the people live in urban areas, which are quite populated, like the province of Gauteng, there in yellow. It's a small province, but very populated. Very populated because a lot of people migrate from rural areas to Gauteng province, the economic of the country. And we have other people living in areas such as the Cape, which is more developed and for work opportunities as well. And cities like Johannesburg, Victoria are in bigger cities. And in terms of the economy, we're still struggling because about 32% of the population, which is mostly young people, are unemployed. So it's a big challenge that we still face in South Africa. And then we also have a burden of a particular burden of diseases. Communicable diseases are coming up a lot, non-communicable diseases, perinatal and maternal diseases and injury-related diseases. Now you add a burden now of climate change and air pollution. So it's quite a lot on the health system. We've seen recently we have floods. In some areas, there's water scarcity. In some areas, we're experiencing heavy rain, flood. And then South Africa is really producing a lot of air pollution because we're still heavily dependent on coal. And areas such as the Highveld in Mpumalanga area that is in purple. That's where there's a lot of coal mines, and the area are very polluted. Communities around those mine high levels of pollution. And then we see a lot of respiratory diseases. So 2 years or so ago, a year ago, Greenpeace also raised a concern in terms of SO2 levels in that area in Mpumalanga. It was declared a pollution hotspot. Okay, next one. So what are the challenges that we face as researchers working in those areas? You can move to the next slide. It starts way back on the history of the country, because our first democratic election was not long ago, in 1994. So we still a young democracy, but not so young. 30 years. So we have this history of apartheid that has caused a lot of disparities between the rich and the poor as well. The rich are very rich, but the majority of the people are still poor. That will lead to people then living in like informal settlements. Some of them they want job opportunities. And we have many rural and underserved communities which are still lacking in things like health services and environmental data. So it's very difficult to do air pollution monitoring in isolated areas. And that's where you find that the majority of people who don't have anything, that's where they live, or informal settlements. And these areas are quite neglected. And this is from the legacy of the past, because there was so much discrimination and just the country was just get funny. So we have a lot of informal settlements. As you can see on that picture, you find a rich area, and then next to that, there's an informal settlement. It's a green area, nice, fleshy, and then next door is it. So we see a lot of such in terms of, especially in urban areas, because people tend to move from rural, but the accommodation is expensive. They form informal settlement. And then, so there's that urban disparities. We have currently more than 4,200 informal settlements where people live in shacks, corrugated iron structures, and they're very protected. But at the same time, we have this rich and fleshy then urban disparity. Next slide. And then we have areas where there's environmental degradation, like the Mpumalanga hyper areas where lots of mining activities leading to air and water pollution, and then communities are very exposed to the impact of these industries. Next slide. And then one of the challenges that we are facing doing environmental EP studies, we have challenges in terms of finance, constraints, financial resources to be able to cover a lot of underprivileged communities. Infrastructure, you might have a fancy sampler that you want to use. If it needs connection to electricity, you can't use it if they don't have electricity. So it's a challenge. Sometimes you want to do everything, but you don't have a proper infrastructure to connect those things. So as fancy as the equipment is, you can't use it in informal settlement because it will be vandalized and there's no electricity. Some of the samplers need internet, there is no internet. So it's still a problem. Government monitoring programs do not extend to rural areas. You find that there's a very expensive monitoring station, but in a more urban area, which is more, there's connection to electricity, safety issues. So areas on the outskirts in poor communities do not normally have monitoring stations, which are sponsored by government. There's sparsely mounted in random areas, not covering poor communities. So our air quality, sometimes these government monitoring stations, due to load, where we have load shedding in our country because we have a problem. You find them, they switch off for 3 hours and switch on to cover everybody. It's only now after that we now have enjoying the midst of it. We don't know what happened, what happened. It is politics as well. So if you have a monitoring station and power is on and off, how are you going to? You'll get a poor data. So and it's a waste of money because these monitoring stations are also expensive, but the quality of data is very poor because of on and off of the electricity, especially in the past 10 years when we had a problem with load shedding. So if you come to South Africa and you hear it have load shedding, you must know that you'll be out of electricity for 3 hours. So we plan our lives according to this schedule. And then we have a lot of outdated equipment, not modern. So yeah, that also gives us sometimes unreliable data and data gaps. I think I've already also touched on remote and isolated communities where you find that it's very difficult to research in these communities because there's no proper infrastructure, logistical planning. If you go there, you have to make sure if you go to such an area like the Eastern Cape, we are going to an area called Bembe next week. It's very remote. You have to make sure you have provision for food, data for your students, logistics, all those things. So it's quite difficult to work in such areas because we need proper planning as well. And it's quite expensive. And then it's very difficult also to do longitudinal studies because of high mobility and migration. Sometimes we have seasonal migrants that come and work for a certain period and go back maybe to Zimbabwe, Mozambique, in rural areas. And then if you're trying to do a longitudinal study, you will miss those participants in terms of follow-up. And there's no communication activity. Sometimes if there's a protest, you won't be able to go into an area where during protest. So if you are sampling in that area, it means that your sampling will be affected because of disruptions and protests, vandalism, all those issues of safety as well play a role. We have a lot of people coming from other neighboring countries, they come into South Africa for greener pastures. Then we have to deal with that as well. Also, now we're seeing a lot of, there's a complex interaction between environmental and social determinants of health. So you have to be able to navigate these two things because you try, for example, to do air pollution monitoring in the area, but there's so much social determinants of health in the area that it's quite difficult to come as a researcher and you want to collect data, but when the people don't have food, they're not interested. All they want is something to put on the table. So we have to try to navigate, distinguish between your research and also what's happening in the society. So people don't buy in when you come into their space. They have nothing, but you come with this expensive equipment to try and collect the data. So navigating those things is quite a challenge as well. Because in the end, it means you have to organize things like a stipend to give those communities to watch your equipment so that it doesn't get vandalized when you monitor this. And then political support, sometimes it's a challenge to working in these communities. You have to get support from local politicians as well, the chief, the leader in the community, they have to buy into the project to be able to enter that community. So we have to be able to negotiate your way in working in these spaces. And then we have issues of climate change coming to the picture as well. We have other issues. People are, when there's a flood or an emergency natural disaster, the focus shifts to that. and then your research will start. Next. And then in low, in areas where there's low literacy, you also have to explain yourself, which is quite difficult to get participation from communities. And then I think I've also covered logistical barriers in terms of poor infrastructure, transportation, logistics. That might be a challenge in working in vulnerable communities as well. And then also in vulnerable communities or rural areas, we have a lot of incomplete health data. Sometimes we have monitoring data, you want to compare with health outcomes, but there's no, your clinic data is not captured properly. The files are missing, you want to know the number of children with asthma in the area next to a mine, there's no health data. So you struggle to compare to look at the health outcomes. And a lot of politicians and policymakers, they want to see if you're saying air pollution causes respiratory disease, they show us the statistics. If that is missing, then you cannot be able to police. They want to see the numbers. They will say, we don't have the numbers that you are talking about. The WHO is somewhere else. Where do they get their data? So yeah, it's a challenge. So we have to try and sort out basic things at facility level to say, if we say air pollution causes respiratory conditions, for asthma, eczema, wheezing, we should be able to say, but look, the number of kids that came to the hospital last week, then it makes sense to a policymaker or a politician. Data validation, validating environmental data is particularly challenging in South Africa, where official data sources may be limited or unreliable. I've touched on this as well. It's sometimes difficult to get robust data, for example, from our monitoring station, to come up with proper conclusions that will influence policy. The next slide. Now, there's a lot of things that we can do to try and improve where there's challenges, and expand monitoring networks, increase and update our air monitoring stations and so on. But that will obviously work if we have politicians in terms of safety of our equipment and so on. And then we can leverage on mobile technologies, but that will also depend on whether we have electricity or not, because such things need, so only the government provides electricity. So you can buy expensive equipment if there's no electricity in the area. We are trying to move to, for example, low-cost samplers and all that are reasonable and they don't need electricity. But it's hard to find because most of the time we have to buy overseas to import such equipment and figure out how to use it. Then also we need to strengthen our local capacity, more training for our local researchers, and then foster community engagement. A lot of education is important. Communities are not aware of what they're exposed to. So working with communities, community participation research is the way to go now, because you have to get buy-in from your communities so that they take charge of, they become part of the projects, and then it will be much better. Standardize our data collection, and then funding is also necessary. So we can also advocate for long-term funding and public-private partnerships and collaborate with other stakeholders as well, government, non-government organizations, and local communities. I think the time of working alone as researchers, it doesn't make any. communities are now need to be involved in this project because they always ask, what are we gaining from this project? Can't come here, collect data for the university and disappear. So, but it will help if, a lot if we work with them because then they can sustain your project for long-term projects. Then you don't just collect data and go away. If they're involved, then it's much better. Next slide. I think I've touched on community-based participatory research, which is a new thing now, especially from epidemiology. We're used to working in silos. It's changing a lot now. Multidisciplinary collaboration, the days of working alone as a scientist in a corner, it's changing. Transdisciplinary, multidisciplinary collaboration, and that is, we have a nice paper on architecture, social determinants of health, how they link, all this collaboration are starting to take shape now. Because we can't work in silos. There's too much, there's a link between social determinants of health, environmental factors. So you can't solve one issue. Politics are involved, communities, they have problems. So we need to try to work together. Capacity building, we need to invest more, especially on our young people, and advocacy and policy education, translating the research that we do into actionable policies. Next slide. I'm just going to touch on some of the research projects that we've done in this area. The next slide. We've done a project on air quality, climate factors, and the built environment and children's health in an informal settlement and housing. So you can see in an informal settlement, preschool will look like that, but it's informal. It's not your formal government. People just, because a mother will see children playing on the streets and then gather them together and preschool. So it's those kind of places that are not serviced. So we wanted to monitor the indoor air quality. It's hot in the summer. Those informal structures are very hot in the summer. Okay, next slide. This man, a PhD student, measuring in the trees. Okay, next one. And then we have a paper on that study as well. The next one. And then we did another study in Mpumalanga, in the mining area, polluted, an area which is very polluted in Mpumalanga province. We looked at nutritional and environmental risk factors as well, and us. Okay, next one. So this is a paper from that study, the prevalence of wheezing and the environmental tobacco smoke, because we also look at indoor air quality. Next one. And then here we did measurements on SO2, NO2, and preschools for the same study in Ghana. Next one. This one we did in Babopani as well. Indoor and outdoor air pollution and health risk just outside of Victoria. We're still finalizing a paper on this one. This is what the preschools look like. Dr. Janine was a co-supervisor as well for this time. Okay. This is okay. It's part of the one study we just did. The PhD student will be graduating next week, actually. We'll get in indoor and outdoor air pollution sources and atomic eczema in preschools. And then we also monitor some VOCs, SO2, NO2, and VTEX in preschools in Mabopane. We are yet to publish this one. It's a minus still it. Next one. Okay, this older paper on us we did in next to the big airport in Ekurhuleni Metropolitan Municipality on air pollution and wheezing and then the allergic rhinitis as well and traffic. Okay, this one was for indoor air. Mostly we found significant association between tobacco and eczema, also among 13 to 14-year-olds. We're currently working on a proposal to look at the district just outside of Johannesburg. It's a rural area. There's a lot of platinum mines there. The PhD student is starting now. And then second study in Bujanala, another PhD student is starting on this one. It's also a platinum district to look at air pollution and respiratory infections. Lots of mining, and then around the mines, you find community settlements, and it's mostly sometimes informal settlements because people will just don't want to travel far. They will have homes around them. And that's the problem because those informal settlements end up not being serviced. Thank you. I think that's all from my side. I don't know if there's any comments.
Maybe we can leave the comments to comments. Thank you, Joyce. Very nice presentation. Our next speaker is Beatriz Oliveira.
Yeah.
She is from Fiocruz. It's she's called Cruz Foundation. It's an organization from the Ministry of Health. In that monitoring development studies in health for Brazil. Leadership and
Onde que é na tela cheia? Iniciar. Não, mas eu quero.
The title of our presentation is Forest, Climate Regulation, Air Pollution, and their effects on human health. Please.
Yeah. Oh, good morning. Good evening. Are you trying to speak in English, but maybe I need to be in Portuguese and English. But okay, I am Beatriz. I am nursing. Yes. Look like not, but I am. And yeah, I am PhD in public health and to personal foundation. And now I am taking a position in this institution. And the Fiocruz Foundation is in several locals in Brazil, maybe several offices. And today I take a position in northeast of Brazil in Piauí, but now I'm here in Rio. And more, I work like a consultant of the health industry. And my research areas in climate change, air pollution, and the factors of human health. Today, I would like to present our studies and our working. And this working have several goals and like a question and our group. And we have also several institutions in Brazil, and always one people the work institution contributing of the network. And not we have been working on some lines recession, like studying on the relationship between climate and air pollution health outcomes in health and morbidity specifically in Brazilian Amazon. And the other line is about the projections of the impact of climate change and health outcomes, and explore different assumptions like temperature, precipitation, or heat stress. It's not heat wave, but heat stress, because you using and specifically indicator for this. And heat wave and climate sensitivity and distribution of the zones, like in human, rats, virus, and our host now, and several diseases, and in specific that topic. And the other topic in line is about to forest the service, because we have so the idea is okay, tree could be saved in the world, but not behind is only in carbonic, but and the other services, because we have this low provide climate regulation, provision, foods, and future and human health products. And this topic we work with local practice of the climate and on temperature and its impact on health. And we work with specific groups, it's like indigenous people, black communities, and Islams, okay, in the urban area. And the other topic is about to elaborate and create new tools for communication of the risk and consultants for the stakeholders. So, in the first thing, I'd like to show the Brazilian Amazon conditions and profile of disease and the morbidity and mortality profile. And this Brazilian Amazon, in Brazilian Amazon study disease, but we have the same areas or risk of areas to die by cardiovascular disease, respiratory disease, and this over the external hosts. And like this, and here we have so these risk highly risk of to die by respiratory disease, and here circulatory, and here by external cause. And in this last, you increase in all region versus Amazon region. The next is observed in these global burden disease is overlap and separate risk of the environmental risk. And for instance, we have so changed the pattern of two fluids, the gradual fluids in Brazilian Amazon, and the frequencies it is more increasing and reduced interval. Yeah. This is here, for instance, the gradual fluids in Manaus. We have capital of the Amazonas state. And here, only all high level of the river. And this is the data. It's so separate, and we have increasing frequency of these events. And here, it's about reduce the levels of the river there. And so, the more events, the droughts, when we reduce the mineral and lower level of the river level. And in 2020 and 2023, the last year, and the same times you have so sorry. Because in Portuguese, but at the same time, you have some other problems by air pollution, by virus burning, fires there. And this is allows during the dry season, and at the same time, you reduce the levels of the river. Right? And now it's climate, it is exposure to air pollution, and it is here because it is normal, or it is not more events, it is normal for the information. And here you have so low cost sensor and measure air pollution, PM 2.5. In several locals, you have so now condition to be it's so high risk for human health. Okay. And there, it is not problem only Brazilian Amazon, because you have so small and move in dispersion for other cities like São Paulo. And this São Paulo in Sunday, and you have to go to the bad conditions to get there. And this is monitor air condition there. If you have so not good condition to breathe and to practice exercise. I think it's easier. Okay. So we have several projects and study and evaluating to assess this condition in several locals in Brazilian Amazon and the other varieties. And here we study the relationship with climate change and our health, and study and 60 different definition of heat wave and capitals and cities in Brazilian Amazon. And here you have so more risk to die according to the intensity of the heat waves there. And here the groups more vulnerable for pollution in these events, like elderly and die by respiratory disease. And here, the other study, we investigate and explore the effect of the heat stress in UZW wet global temperature and wet global temperature indicate how your body feel and support fire. And do not support this exposure to die. And these we study this condition in two phases. The first phase is to make the effects of exposure in afternoon exposure to WHO and to estimate how young people die by respiratory. And when establishing this relationship, you apply in future using the climate models scenarios or climate model scenario in future. And for instance, in Mara and Brazilian Amazon capitals, we have so increased so lot the attributable fraction of the death by the condition. So for instance, now in this line, you have some 5% of the death by respiratory disease attributable by heat wave. In future, stress condition. In future, it's 13%. Yes, it's increased so lot. And here, and we investigated other outcomes like hospitalization. And this study relationship respiratory disease and hospitalization and in Pantanal. Pantanal is other biomes in here. And the last years we have to several but it is not fire, it is a lot of fire. But event so lot. And thank you for the start of today. Fires there, yeah, fires there. And in here, the relationship is so long, it's hospitalization by respiratory disease in of the virus, right, from the blood. And here, we calculate the number of the death by cardiovascular respiratory disease by this exposure from the exposure. In the last 2 years, in 2020, 2021, we have increased so large the fraction by this exposure. And here, and the other lines, we do our group work, and it's about to evaluate the severity of disease or occurrence of new disease. And here, it's about modeling in virus in Brazil. And we, as here in the first map, you have so which of the bats, the species bats in Brazil. And with these discussions, potential transmission of disease in Brazil. And here, we, and the other map, we evaluate how this disease distribution in Brazil according to different climate scenarios. And here we concentrate this distribution in Brazilian nutrition. And this is have some relationship so strong with deforestation. The other lines, the top with and the word, it's about the forest and the forest Mexican reserves. And your main question here is what is the role of the forest in the people well-being in your forest? Beyond the all behind of the climate change mitigation. And here, we provide new ways to see this study and establishment the positive ways for reduce the mortality in mortality because you have so protected forest. This study is we study the practice combining practice of deforestation and climate change and human health with stress condition. Stress condition because we study we need to reach the value it is not more difficult to support this exclusion. And for instance, here we studied one experiment, and it's a two do get imagined the downtown zone. Yes, and this we replace the forest by. And we estimate the savanna condition, climate condition, and you just in the future combined with the climate change scenarios. And so, and here we can put to expose 11 million people to extreme health conditions, with stress conditions. And for instance, in region and Amazon maybe which and or WBGT 13 or the gross uses. This threshold indicate, okay, you can do more take jobs, you don't take more exercise, including the this condition.
I'm taking to put it on my mouth.
And in this, and for instance, I hear the worst scenario is red, okay? And here the number, okay. Here the number, and here this is our threshold. And now, and so we have so in future maybe in region north the region we reach this value and 15% of the days are there. Yeah, that is reduced workability.
Hello.
more in depth and the workability and the loss of the jobs as well.
Daddy.
Okay, okay. And here we exploring the violent spots in the shoe. And we we could just hear that the worst scenarios for this exposure should be in exposing several municipalities. In these municipalities have not conditional or have not adaptive capacity to resist because it's so small cities and have not health service or social condition to support this exposure. It is important because we have to elaborate on sectorial issue adaptation for universal now. And here, we not only regional impact, but here we can increase the scale and investigate and explore the change of the current legal context in local communities. Here, it's an case study in indigenous areas in multiple states. And we cut and designed the communities. And these communities have 25 areas. And the borders, we defined several times the borders and study the preservation inside and outside. And then we investigate how impact increase of inside and outside in this code. And the first map that showed the map and how to build this area. And here we study, and the first graph is several areas. And to cover behind. And here the several communities in Mato Grosso. And we observe the deforestation rate. The deforestation rate is higher in outside this area, specifically in these two areas, because the two areas is more resilient. But it's so high, so pressure there. And I think I would like these areas for expression, but I don't know. And here we have so the increase of temperature. And temperature is more high in outside, but in inside increasing as well. The temperature is so low. And the picture we would like to see in the other climate scenarios, in late use scenarios projected in the 2027. And the first area in the top is we work is to elaborate new tools for risk communication and to support the stakeholders. And this is the platform in Portuguese, sorry, situate the platform, and this platform and estimate the several indicators to heat waves for heat waves in every municipality in Brazil, and by municipalities and states as well. So when you click this, you have how much increase in the situation in this local. And then we have this resource for response as well. We have so the preference and duration and intensity as well. Okay. In future, like to elaborate this platform to forecast for 1 week. And these for an example in Europe, you have so forecasts from these states and based and increase of mortality and hospitalization. And I'd like to do this for situate temperature and air pollution as well, if possible. Yeah, okay. Love for it. And then we have some collaboration with the health industry, and you elaborate and give several items to consult but to see the condition, air pollution, and industry. Using modern data, but okay, but yeah, and to see, and the particular merit is good, but it is not good for the science. And the taking condition to stakeholder to see and building new actions about this condition and all human response. Because we have so to serve the actions based on modifier, okay, it's not possible to do it's it's only in São Paulo, Rio, so we use the modern data. And yeah, I think so. And I would like to because I would like to and maybe building new collaborations in this area. It's like to something for us.
There?
Hi, yes, Washington, I'm here.
Can you introduce Sean?
Yeah, Sean's talk is on, let me just open again the slide. Oops. Where did I put it now? Or perhaps, Sean, you can just put up your, I think it'll be quicker if you put up your presentation as well.
Okay. Well,
It's on addressing, I can vaguely remember addressing gaps and threats.
good day.
Vai lá, não, vai lá no. Ah, tá. Não, de volta lá. Deixa eu ver. Sorry. Aqui, né? É perto. É, aí eu abro com. Qual que você falou aquela hora, eu acho?
Control. Person, welcome. You introduce yourself.
Okay, all right. Good morning and afternoon, everyone. Thank you again for the opportunity to present and to share some of our work. So today I'll be talking about under the theme about navigating epidemiology for the South, but particularly focusing on how we bridge these knowledge gaps. And I'll share a bit about what the gaps are and what we've been doing to address these and some of these emerging threats. Also belong to quite a number of working groups for American population health. So a lot of the studies I present is based in that unit. A lot of the work is around levels control. So the areas where we are currently working in, part of the area of control is happening in those types of areas. And then lastly, in order to sort of bridge the gaps, I'm part of the Center for Environmental Justice in Africa, where we are seeing how these gaps can actually be filled with policies that go with South Africa.
Sorry.
Okay, so for further talk, I have a number of things very briefly, just around the topic, just a few thoughts on that. And that really lays the scene for climate change. And what I think is quite important, we don't always talk about, is this definition of environmental health from a public health perspective. I have two examples of studies we're currently doing on environmental and social determinants. I think in order to address the gaps, we need to think about public health, environmental health, and their role in One Health, because that's really where the funding is going into, and most the policies are being catered to. But it's only really focused on zoonotic diseases and not really incorporating environmental health, environmental epidemiology. So we also need to raise our voice in that space. And by doing that, how do we engage stakeholders and role players? How do we tie the SDGs to One Health? Because the SDGs are primarily focused on everything, but the environment is sort of one SDG, but it's actually not. It actually covers all the SDGs. So using the One Health lens, how do you do that? And then in order to train the next generation, we can't always say we want to make the changes in research, but get our students who are not trained on some of these topics, because our curriculum is not going to change. Teach the same program for the past 10 years and still we can change. So a few thoughts and a few examples on curriculum development and how we need to start thinking about this and changing it. And then I'll end with a few challenges that we have and some opportunities, I think, how we can bridge these gaps. Okay, so walking about the topic, really it falls into two categories in Global South. One around the contextual challenges. So these are adverse environmental conditions, limited access to resources, and really this disparity in collecting data that's we're speaking about. And to bridge these types of gaps, we need to have collaboration, but also we need to shift the focus and really need to be as resilient as we can. So there are two papers here. The one I'll talk about a bit later on, but it's that we need to collaborate between different disciplines. Because very often siloed work doesn't work. So how do you go about doing that? So I'll speak later. And the paper at the bottom about COVID-19 and barrier elimination. We always have, in the past 2 years, we've seen that a lot of changes have been happening around COVID-19 in terms of resources. All of a sudden, government has resources for them. There's a workforce behind them. So what we are getting there is that why can't we build on all of these inroads made in these last 2 years and move forward the work that we have been doing? And malaria elimination is one of the examples. These programs are going on for decades. English is going on for decades, yet there's limited resources. But now that you've built the capacity in 2 years, why can't you use that in terms of capacity development and environmental professionals, for example? So we argue that in terms of potential challenges. So what we've been seeing more and more in the Global South is a change in the prevalence of climate-sensitive diseases. And the two papers that they published last year, we see that we have a local research of some of the malaria vectors in the areas in East Africa bordering Mozambique and Zimbabwe, where and it's due to climate change that we're seeing a surges in these populations. And as an effect, we have behaviors of individuals starting to change because now they are it's new vectors, it's climate is starting to change. So their own behaviors about staying indoors, when the sun's being written, that is starting to change. So we really need to rethink about the type of studies we are doing and that these communities we are working in, they are being at risk by being in these areas. So what are these adaptive studies? We talk about resilience, community resilience. How do we actually go about doing that? And we need to also recognize the role of environmental health in this disaster preparedness and response. Because we don't really play such a big role. It's really focused on human health, it's not diseases, but the environment is lagging behind, yet due to deforestation now, it's emerging, yet the environment is not really weighted the same. Our population health, which is up here, we're looking at these different types of exposures and how in terms of the global south, South Africa and Brazil, it's the industrialization, urbanization. Things are starting to change rapidly, but the resources, the support is not changing at the same place. Slide. So, I mean, we're all familiar with climate change, different type of imposes. We talked earlier about the vulnerability factors, but aside from that, there's also the climate-related hazards as well as the exposure. But in terms of the research, we're really focused on vulnerability-related stress or respiratory diseases. But there's also another component, which is the healthcare systems and facilities, also need to be involved into the conversation too. Which is quite important because if you have a stressed community that is faced by environmental conditions, climate change, the health system cannot handle a sufficient stress. So how do you also balance those two? So one thing is looking at communities themselves, what is happening in the communities, the environment, in terms of social determinants, in order to understand what needs to be done, both on the level of risk management level, as well as in terms of the governance structure. So I'm going to go back to just the definition of environmental health, and this is from the WHO, which actually really says that environmental health from a public health perspective concerns both the natural and the built environment, and that includes human health. There's interaction between people and the environment, and we do know that environmental. Okay.
Sorry. No. Sorry, it's not sharing the screen. We tried to. Okay. There is several.
We go right.
Control and.
So. Smart. Sure. Yes.
Okay. Okay, I think let's just go into the second slide, and I'll just recap it and go back to the
Sorry.
Okay, so we are on.
Sorry.
It's okay. Okay. No problem. Okay, so I think if we go back to the definition of environmental health, really refers to from public health perspective at least, this interaction between the natural and the built environment, how that influences human health. Interactions between people and the environment. So you need to look at both the social as well as environmental determinants, and that really environmental factors that potentially influence health and assess interaction. So what I'll do now, I'll talk about two specific projects that we are doing that speak to environmental and social determinants. In particular, how they can impact on climate change on environmental and social determinants of health, but towards developing a climate resilience strategy. So how do you look at these determinants of health and how behaviors are they influenced by climate change and how these vulnerable communities in the areas we're playing, how they can become resilient, or what are the practices for resilience? So we do these communities for many, many years. And despite all the changes they have survived, so what is their understanding and are they being able to do that or not? Next slide. So the study area currently working in is within border of South Africa, Mozambique, and Zimbabwe. We have three different study sites. So the two the early papers I talked about the resurgence of the malaria vectors is really in this area over here, and the area that's in the border, there's still high it's still it's quite high risk. We have lots of migrant workers, and monitoring is quite difficult. There's no closest weather stations by the way. So even getting something as simple as weather data in an area is a bit on the problematic side. Inequality monitoring is not really occurring in that area at all. We tried with South African Weather Services to have a mobile station that also has a bit of issues around it. So in order to start somewhere, we thought let us get the buy-in from the communities. Let's start doing baseline on the ground, collecting some data. When we have that type of data, we can then go further and say, let us now do some air quality monitoring. Let's put those sensors in the houses, but let's first start simple and understand what the baseline is. That's where these studies will start. So there are about three different studies in the area. So the first thing you have to do is really understand the water sources in the area. What is we do know that the water sources are in 17. So we first try to understand if people are dependent on water, there's no running water communities, then either on all water or the rivers and streams. What are the chemical contaminants present in these types of water sources? So when a student that looked at identifying what are the water, is there any antigenic effects, screening for pharmaceutical products in the water itself, and also looking if there's any viral contamination. Let's present just some of the work. So in the areas we found a whole long list of pharmaceutical products ranging from various therapeutic classes. So just by looking at all of these, we do understand that there is a major constraint. Whether or not these are from practice, people aren't aware of waste disposal, or it is from other communities. Because the next slide. You see there's herbicides and insecticides, for example, is that from the farming area that's around there. So there's a whole lot of issues around knowledge and awareness, just around environmental health, not even monitoring anything yet. So are those issues that actually need to be addressed first about safe and pesticides, safe disposal? Because if you're contaminating your water source that you're dependent on for subsistence farming, that is a problem in itself. This was the first we started with this, just to get an understanding. And then based on this, on the next slide. We then have two PhD students. The one sort of looking at community resilience strategy, but focusing mainly on temperature, thermal comfort, and environmental determinants of health. And the objectives are split into two phases, a qualitative phase. So understanding what these determinants are. Now that we know the contaminants of water, trying to understand the practices in that the area there. Measure the indoor temperature, look at thermal comfort, we know that heat stress is a problem. Because of the structure of the homes, it's very difficult to adapt. So stress. And trying to have these in-depth interviews to understand how people then adapt to the adaptation. And then lastly, we'll look at a healthy panel to understand, based on all of this put together, what are some strategies. So from a policy perspective, if we're saying we want to make these changes, what are these changes informed by the research? So environmental determinants. So next slide. Because we do know that we also need to know the social side. And the same areas we look at this intersection between social determinants of health, literacy, and behaviors. And again, trying to look at social determinants first in that area, trying to identify what is going on in health literacy. We often have all of these material that's provided by the Department of Health, but it's not in a usable way that communities can easily receive the information. It's often very complicated. It's often access to resources they don't have in that community themselves. And perhaps there's other type of information the community would like to have, it's not being presented. So trying to, the second phase, look at the like more of a qualitative study interview, what are these behaviors and how can we change that? And to develop this integrated community resilience framework, looking at the capital frames, what capital community has. Is it intellectual capital? Is it land capital? Is it community capital? In order to ensure that so I spoke earlier about the built environment. It becomes very important in the condition of environmental health that you need these different components to go together. So we should have studied a couple of years ago looking at how these interactions between living spaces, environmental pollution, diseases in these vulnerable populations, how we need to develop a strategy to them off. And we are from three disciplines in architecture and chemical engineering. So I want to really think about how this can get this. So we really briefly, this is all on its objectives, but ideally we wanted to understand how all these disciplines come together and how we form one strategy for having this really well-being of the community. So we published very beginning of the year, and what this diagram basically shows is that from all the disciplines, environmental health, social determinants, the built environment, and engineering, how we need to work together. Because what we need to understand is that the way that buildings are constructed, the environment's not really taken into account. So the issues we're seeing in the environment are sometimes the consequence of the homes. In the areas we're seeing the homes are too warm, so people are not sitting on the outside exposing themselves to benefits. But if the house was built with environment combined, we are developing sensors, but we're not developing them with the people that actually use them. So a part of this project, we piloted using low-cost sensors in an area where, and what we did is we set it up so there's a daisy chain, and we'd actually walk by and if we capture the data in a row without having electricity on. Because from an engineering point of view, that would work for the area. So how does that actually, engineering does play a role. They can't just develop things. They actually need to be people that are using them, and you can see what I want this in particular. So what the diagram basically shows is how all of these different disciplines need to play a role in order to address public health, environmental health, technologies. So in order to sort of test for some of these, we have a study site in Victoria itself, and it's an informal settlement. And in there, working with the community, talk a lot about community engagement. So how we work with the communities, developing the questionnaires, developing the questions to understand what the community needs are. So if we're doing our research, how is that aligned? We know there are knowledge gaps, and to bridge those, we need the community on board to understand problem, to be able to identify the problem, take part in solving it, and at the end to run with the results, whether it's just in some. So the long-term plan of this particular project is the community action plan, where after doing the initial talk with the community, looking at strategies, how it can be actioned within the community, and to integrate, we're talking about social determinants and environmental determinants, but more importantly, to contribute to policies, because that's what we want, long-term fix, but that's formalized. Not something that we just talk about, but actually government officials take a part in this. In this particular study, government officials actually do come to the community when we share the information so that we can start doing things. Right. So if we think in terms of addressing the gaps, it's important to also frame public health, environmental health in terms of fine health. And all the work we're doing around evolution, environmental health and evolution really fits into the one approach. So what I try to show you is that all the work we are doing plays a role in this broader concept of climate change, public health, environmental health in terms of our environment. And what is often seen in one now is environmental health. We are not really represented. So one of the issues that we would start at is Victoria is looking at this one out the change. So how we are using some of these initiatives in order to try environmental health monitoring, our water sources, monitoring our air, for example. How do we gather this information, but still tie it into the annual environmental actions and advices from that? So if we are now bridging the gap, so as far as one of the concerned, we always have a big debate about this particular diagram. Because this diagram talks about One Health, how the ecosystems, how the animals are doing, humans, for example. But the disciplines in the society are always on the side, and they shouldn't be on the side. They should actually all be integrated into one. And what we do as academics is this interplay between these three fields: communication, collaboration, capacity building, and coordination. And we need to play a bigger role in that. Next one. So looking at the SDGs, for example, and I took the SDGs and I'm mapped around One Health. And very often in the environmental, I'm focused on SDG 13, which is climate change. That deals a lot with air pollution, for example. But as a part of that, we also know that we have vector control that's influenced by environmental change. We know that the ecology, food safety, veterinary, all these things. So while we're thinking about this, we can actually meet all of these targets looking at it in a broader perspective, but overlaying this One Health concept over the SDGs. And by looking at the monitoring we're doing, the studies we're doing to fill the knowledge gaps, we are making progress in not all the SDGs, but some of the SDGs. And the information we gave, they can also feed into the work that we are doing. So if you're thinking of who are these stakeholders, and also from that perspective, what we always asked to do is to take part in academic institutions, for example, the center. We do research education and we have the partners, but all of these things then are until the end. What you really want in the end is buy-in from all of these people, whether it's the government, whether it's the NGOs, local communities, everyone has played a role. And we often, the silent approach we are in academics, we only partner with government, we only partner with the private sector. But yet, the global community should also be involved in partnering with the private sector. Innovation makes it easier for innovation and support if these technologies go straight to communities. The benefit is then directly. If there's proof of concept, this feedback goes back to governmental organizations, it gets implemented, you get funding can come in. So this whole stakeholder engagement is quite important to bridge these knowledge gap, particularly in the South and South. So one way of doing it is curriculum development, and we're part of the Pesquisa project. So trying to build the environmental health in this conversation. And it's quite a large group, and it is through knowledge sharing. So the research we're doing, how that influences governance, but more particularly education and research, because we need to train the next generation workforce. And they must understand the new challenges we have. It's not the same challenges, but the curriculum doesn't really lend itself to them, particularly in your first or second years. They learn the basics. Post-grad, they get exposed to research projects, but not really next level. I was just handling Zimbabwe, for example, where they had the initiative looking at different types of ways in order to advance environmental, in particular, and these types of times. So at our own university, we piloted a module, particularly on One Health, and what we did is takes into account all the issues around smart diseases, around changing climate, around for air quality, for water quality, and One Health. And we had medical students, the undergrads in their third year, and the junior students in their fifth year. So we're having both these classes or students together for 1 week. It's not easy, but we try to do that. And the whole idea was that they actually sit together in a room and understand that each discipline while you're training should be able to understand that another discipline actually plays a role. The medical students should understand that certain things you see sometimes with chronic diseases, how are they occurring, where they are occurring. The veterinary side as well, there is still disease, how does this occur? So having these two groups together. So we are the only universities that has a during the school. And we're only running pilot this on the second, the third year now, when it's been pilot. So very briefly, it looks into sort of third year and 30 medical students, 50 university medical students, but looking at integrating teaching models, so using human teaching techniques, world cafes, redesign virtual escape rooms, creating digital artifacts, for example. And through all of this, trying to really deepen the understanding of environmental health, exposure, environmental epidemiology, slaughter diseases, how we incorporate that to evaluate what issue we're currently dealing with. Public health is complicated, environmental health is complicated, and we need all of these issues. But teaching skills around how to problem solve, how to engage with different types of people, and need to understand how this interdisciplinary collaboration. So to end with a few challenges and opportunities, and I think we are quite in number. From a policy development and legislation point of view, I think it is time to start incorporating what we're doing into the policies. The policies are often very one-sided. They've not been updated for a number of years. I do think there is an opportunity to actually speak up to that around sustainable practices. We burn forests rigorously, but there's no sustainable practices. Institutional arrangements, environmental health units, for example, they exist in some universities, but not in all. This cross-sector environmental health committees that take into account the different stakeholders, scientists, public health professionals, bring them all together to discuss some of these issues we have. So with the Center for Environmental Justice, we're trying to have these types of conversations with the role players, both locally and internationally, to actually bridge these knowledge gaps that we have. Next slide. In terms of capacity building, to integrate environmental into education, so some of the teaching that we do, modules we do, both from a undergrad and postgrad perspective. We've also developed some for working professionals. So while you are working and you're out there on the ground, how can we also try and support you? There's a big advocating for such grants that are more transdisciplinary. We often have the call for the grants, so we will write the project, submit. The one conversation that is actually reviewers are not trained in multidisciplinary research. You get environmental health specialists and environmental grant, but it's not environmental health. It's a climate change grant that has freedom. So it gets rejected because your review committee is actually not the right. So if we're going to do this, we actually need to rethink this space. Community engagement, public awareness, we spoke a lot about that, community campaigns, led environment, but working with the community. One of the papers we published talked about having community as a thought partner. So in the developmental phase of your project, bring one or two members in to discuss the issues, who can help, who's willing to see this project through. When there's buy-in, then there is resilience of the project. Excellent. International corporations, such as the meeting we had here, trying to grow these networks for collaboration. But also one thing that's very important is monitoring and evaluation. We don't monitor enough. And because we don't have the indicators that we have, don't specifically measure what we want to. It's difficult to say there's progress. If I can't measure something, how am I going to say I'm making progress? Yes, no. So that is one thing we need to look at. And to really conduct these environmental assessments in order to ensure that we are achieving the goals. So as the last steps, from a scientific perspective at least, from the research side, so the figure on one side, trying to create a platform, this is one platform where we're trying to bring training, research, government together to have all of these discussions. And the other side is Africa, it's a multi-institutional collaboration, where we're looking at creating this Institute for Pandemic Prevention and Preparedness. So some of the emerging diseases of hits we're seeing is as a result of the changing climate, but we can't necessarily address them because there are issues around we don't have government systems that are accurate. the epidemiology of things understood correctly. We know that there's not enough screening. Clinical research must be done. There's a lot of things around it. So this project is aimed at bringing all the institutions together and having one institute that looks at all of these, both in the short term and the long term, with capacity development. Just that majority of these studies aren't possible with a huge funders behind it. And we're grateful that there are at least a number of people that are keen to fund these types of projects and to think about, although in the global south we don't have access to data, doesn't mean we can't collect data ourselves. I think we always have to collect data from the we can actually do it ourselves. It just means the investment needs to be there. The investment is that we collect data of our own. Our own data will show us and we show what this is our outputs that we're seeing. To develop an early warning system with your own data is more efficient than trying to model it based on another database and hopefully show them where it might work. So those are the issues that we have, but I do think there is room for growth. And I think there is we can address these challenges. Thank you very much.
Great presentation.
I need just 2 minutes because my presentation is not here. Eu tenho que precisar salvar aqui de novo. A apresentação, tem que tirar.
Mas você pode falar.
Tá. Cadê agora? Não, mas cadê o Zoom aqui? Não fiz nada com o Zoom. Ah. Ainda não aparece. Sorry. Problem.
Next speaker, Tatiana Moraes. The type of is common environmental drivers of the global south, tailored preparedness and response strategies in environmental epidemiology. Can also introduce yourself.
I will try to speak in English, so feel free to ask me if it's not so clear. My name is Tatiana Moraes. I am a psychologist, and I am new here. Thank you for inviting me for this presentation. I'm really new. This is my first day. First day. And I am a psychologist with a background in public health, master and PhD in public health in Oswald Foundation, and also a postdoctorate in political science. So, University of São Paulo. So maybe I will go to ecology, come back to public health, and some moments I can talk more than I showed about forestation. So I think everything is connected. I can see that in some moments I can talk with each of those presentation. I hope that. So first, when Washington invited me for this presentation, I was reading why I thought this title. I don't know if I had success to talk about, but I was reading about the new outbreak of mpox and the role of mining in Republic Democratic of Congo and the transmission, the new characters of the mpox transmissions, this kind of. So I was, and we have a lot of, I will talk about mining, with mining projects, illegal and illegal mining projects. And I think this is common for thoughts, for several countries, not just South, but we know that it can be worse here. When I say here, it is global South. But how the exposition is embodied is different. We are not the same. We have some, because when we talk about North and South, some moments, okay, South is the same. And the same demands, the same needs, and this is not true. So the idea is that instead about we have what we have in common. Okay. So here, what's this map? This is a map of biodiversity, and this is one thing that we have in common. This area, the south and main tropical regions, where we had the most biodiversity in the world. We know that, not just forests, but also found animals biodiversity. For example, this map is about birds, mammal, and entomology issues and insects. So in some moments, we can see more in public health having a higher level of biodiversity as a problem. And it's really common a good thing as a bad thing. Just the problem having forests, just the problem having biodiversity. And the idea is that this can be a problem, a challenge, but not just that. And here, we work a lot with in Brazil with Payam's territory, the regional scale, working with Payam's Amazon, the most famous, but you're talking about Pantanal, and the driest region is also a biome in Brazil, Caatinga. So why do we talk about biomes? We choose this scale because this also is related to how people live there. The researchers that our ancestors had there. So this is how people live today, but this is associated with the demographic conditions and the occupation of these regions. So this is, we talk now about world health, but our history is based on environmental, animal, and human regions. So why biodiversity matter? I think I will talk about this further. It's so I didn't introduce myself, my work, but I work with climate change, air pollution, vector-borne diseases, pesticides, that. But the last few years, I am also working with pandemic preparedness and response, for sure, after COVID, and environmental health. I think that some people discovered that this is a relationship. And so we can talk about spillover, but we can talk also about researchers how we use the resources, how these resources from the forestry, from the rivers are associated with alimentary, safe, the nutrition characteristics that we have, the exposition of this population, and how think about building, how we can work protecting our people using what we have. So here, despite the good things, here we have the one thing that we have in common is the vector-borne diseases as a big issue. And here, I think it's important to talk about the epidemiological transition. That is not just in Brazil, this is very characteristic. Having infection diseases, vector-borne diseases, but also chronic diseases, higher burden, some types of cardiovascular disease, respiratory diseases. So we are overlapping our problems. But here is the diverse just for of vector-borne diseases and vectors south. So here we can see that in Amazon mainly, but all Latin America, understood. All Latin America and Africa continent, India, we can see the number of the overlapping of vector-borne diseases. So now in Brazil, we have the last since 2019, we had the epidemic of dengue, chikungunya. Zika is not so high now, it's decreasing. But now we are having problems of pollution in different regions. So this is not just environmental problem, but is pressure. The health system are primary care are under pressure for diseases, and there's a lot of other problems. So here, talking about the spillover, we know that we are exposed for more than other countries, other regions, for new diseases, emerging diseases, and re-emerging diseases. We saw that in malaria in the Amazon. We have papers, we can find papers from 2015 talking about the end of malaria in Brazil. And 5 years after this paper, we had a huge epidemic of malaria here because the drivers, the environmental drivers are present and stronger. And we didn't care for the drivers, so it's hard to talk about the end of the disease here. And this is why it's not just the emergency, but also the new diseases, but having all the diseases again and again and again. And I know everybody talk about spillover, but thinking about global health, what do we need to detect for early detection for this disease, for the new threats? We have, for example, in Brazil, we are discussing about diagnostic, about lab infrastructure. If you have conditions to identify new virus, new agents here in the same level in different regions, not just in the Amazon, in specific cities in the Amazon, but also in livestock. And because we are also talking, we have a huge but diverse of birds that also is an issue last year and this year. So are you studying these birds, where they are, what kind of species and the relationship with the humans, but also our health services are prepared for this emergency. So Other thing that we have in common is our social inequity problems and the finance. I decided to bring the Gini coefficient, and the person, because Joyce talked about that, it's not just talk about poverty. It's talk about inequality. We have rich neighbors. We have very good infrastructure in South, but the distribution maybe is a problem. So, and Brazil is among the countries with high level of inequality. So you can walk in Rio, and you know, is so clear this inequality, actually sign of this inequality. And this is not just the social determinants, but social determinants and economic determinants, the dependence of North resources and financing is also associated with environmental determinants. I work with different large projects, economic projects, and I would say that the most difficult argument is the environment. When people talking about environmental health, when people see the threat, but it's possible having a safe environment. We talked about the unemployment in South Africa is more than 30%. So this is so weak. You talk about PM 2.5 when people are talking about jobs. It's really hard. And I think this is among the main problems for environmental health in South, because we are discussing so basic things before. And as to engage population to talk about we are interested in. And our dependence of international funding and thinking about the biological research, we are really dependent. I was some weeks ago talking with some co-workers from different countries, researchers, and someone asked the main problem. And funding was the normal, and it was for everybody, the main problem was funding, also for research. So we are trying to research what is important for us, but not with our money. How do we do that? How is possible doing that? So is sanitation, the dust is a problem. But we have this is in Brazil, and I think in other regions too. The main problem is the sewage structure. We have we improved the water access, but not the sewage treatment. And some moments the household is better. So we have that, but we don't have after the household, we have we don't have treatment or network. So considering the climate change scenarios and the disasters, this is a big issue because it's okay, the house is a problem, not having bad or better conditions, sanitation conditions in the house, in the household is a problem. But when we talk about disaster, we are talking about the environment, the neighbor, the places that is not just my house. So, and in the climate change scenarios, this is the big issues that I think we are not talking enough about that, because it's a moment that we're trying to have the health conditions, the health sanitation. So how can we improve sewage network in rural community, in forested areas, without thinking about biodiversity, but thinking about sewage, because this is. So this year we had one of the worst disaster in Brazil. the southeast state, Rio Grande do Sul. And we had the floods in most of the half of the state. And millions of people were affected. And the official number, I checked it yesterday, the official number is 173 people that's dying during the winter, but millions of people were affected for weeks, more than 2 months, and some cities are affected today. This happened in April and May, but I believe that we had just for leptospirosis, that we had almost a third death for leptospirosis. So I think one proposal is thinking of difference in direct death from disaster. Leptospirosis case is also attributable for this disaster, and we have strokes associated with disaster. We have cardiovascular disease, a lot of mental issues about, and that is also suicides associated with these disasters. But when we talk about this disaster in Brazil, it's so recent and it's painful for Brazil. But when we compare with what happened in Libya last year, that was I think it was the worst disaster associated with flood in the world in recent history. And Asia in 2013 is really the equality, the information is also, we can see a bias in this information. Of course, that is not the problem are different, but this is not just our problem, just one state problem. I think now in Brazil realizes that the climate change disasters for country, we have different type of disasters, but we should see that this can be worse, and some places are happening. And just one thing more, that one thing that we know about climate change is that the intensity is higher and the frequency is higher. So our graph is different because disasters are presenting higher intensity and frequency. When our health systems are recovering for one disaster, we are having another and another. So this disaster happened in April and May. March, we are having our worst dengue outbreak in the country, also in the south. And today we are having our worst fire, and this is a dry season with a lot of fires, and the worst quality of air in how many years? I think this is the worst that we mapped data from quality of air and fire in different regions. So our primary care system are trying to talk to some problems about dengue tuberculosis, but having emergency associated with recovering some regions from floods. But now the problem is respiratory diseases and crises. And so how can we help our primary care systems to work with this? And this is the new scenario, the new reality, the new normal. You talked about the new normal.
Yeah.
Yeah, the new normal. Yes, we don't have normal. We don't have time. So, okay, I will plan for the next year. No, you don't have time. You need to talk now about all things. And
But for me, the main problem is water. Remember?
Yeah.
Because we have so close, okay, we have
Yeah.
limited water. Now, we have a lot of water to drink there in Brazil and Amazon. So for me, the big problem is the water.
yeah, and when we talk about mining, is water. Hydropower, that is water. This is the management of water. Because we are poor, we are inequality, we have political fragilities. So it's easier having large projects, economic and projects in South. And because you talk about water, because my example is all of them related to water. And when, for example, livestock here, is that in Brazil is the main source of greenhouse. Yeah, it is from livestock. And so this sector looking for new areas are deforestation, deforestation at the Amazon region. And the difference is the presence of water in this region. So they don't want to fight the region. It's the region that they have access to water. I give just one example. I studied that I work with, I bring this example because this is 22 study and 2020 to 21 study. Because the idea is that the range is not alone. It's difficult to thinking that we have just one emergency in public health, environmental health. It's everything and together. And in this study, we worked with the forest fires to understand if in 2020, this was our worst year, several years for forest fire in the dry season in the Amazon. And we had the beginning of COVID-19 pandemic. And in the capital of Manaus, we have just talked about Manaus, the capital had the worst, among the worst cities in Brazil during the pandemic. There was a lot of that and the collapse of the healthcare system. So we try to understand the cumulative impact from fires and the pandemic, thinking about not just COVID-19, because the diagnosis was not so safe. Not everybody had access for safe diagnosis. So we also worked with the SARS, because we don't have a lot of data. We have good data in Brazil, but not the same quality in your regions and not during emergencies. So this is harder even having this data. So we worked with to understand if death and hospitalizations were associated with these fires. Here, the yellow folks points are the folks where the forest was burned. And the gray is the plume, the particulate material. So we can see that not necessarily where the forest is burning is where the people were being most exposed. So the wind behavior is very important, and the geomorphology of the region is also so important. So we mapped all environmental factors that are very important. And here, its line is municipality, concentration of particulate material. And the red line here is the limit from its neighborhood zone. So we can see that this is temporada de queimada, this is the fire season. That is the dry season, the dry season. We can see that a lot of municipalities in the Amazon, the bigger ones, is not very much. So what we found is that we found association between the exposition for particulate material, not the point of where the people that lived in the focus points, the forest points, were more protected than the people that was exposed for this plume. And so the association, we found association in some states with the hospitalization of SARS, because the death is associated with other demographic characteristics. And it's important talking about environmental issues, environmental health, without speak about health services. So the Amazon region, where we had black and gray municipality regions, is when the ICU beds is under the recommended level. So we had high concentration. This is why I think it's not talking about poverty. We had a lot of ICU bed access, a good access in Southeast region and the coastal region, but the rural municipalities, and it's not the same. And we had in almost the biggest state in the Amazon, the Amazonas state, for some sources, in some moments they just had ICU beds in the capital. So, and we are talking about rural, touristic area, and people travel not by car and by river, by boat. So you can spend 2 days, 3 days, and arrive to the capital. Thinking about COVID is possible. Travel 2, 3 days by boat or more to find an ICU bed. So the number of that, and some cities, some communities are so isolated that we don't know if people died there. Because, okay, I will travel after my relatives died just to have official documents. So this is a big issue and a hidden inequality about healthcare. So, trying to finish it, thinking about environmental and health data, I agree that one of our main challenges is having data, and having data for specific groups, population group, most vulnerable, and is harder having act as part of the most vulnerable population, women, rural community, indigenous people, Quilombola communities. So I think this is a big challenge. The data for healthcare infrastructure and services is where now we have a platform in Observatory of Ambiental Health Observatory Fiocruz that map the health structures, health services, so someone can plan thinking where I have a primary care unit, ICU bed. I think this is a basic information, but it's harder having. And the local and the regional environmental data. I use a lot of, I work with satellite data from satellites, but in some moments we need having territory data and from people that live there. I saw that you have a lot of projects in the communities. I think this is the difference, because environmental data, some moments you can find the distribution of climate variables or air quality, but not where the border of the forest starts, where the community is living and how what is the distance between the community, the neighborhood, the forest, of the kind of the forest. So I think we should also work with this data. Surveillance, and now I believe that our efforts are in two ways, thinking about servicing environmental issues, is to having early detection for new emergence, but also thinking surveillance, thinking about 10 years, 20 years, what we can do in 2 years, in 10 years, and in thinking about climate change. And so this is one gap. And data sharing and policies is not just a health sector problem. And in some moments, we talk and the health sector said, I need the water quality data. Okay, but the environmental sector is monitoring, but then we needed to share this data. Or the private sector is monitoring. Where is this data? So we needed to improve our intersectorality and risk capacity, diagnostic. This is I think diagnostic is important for individual level, for clinical decisions, but also for public health. So, and I believe we should talk about diagnostics as a right, a human right to respond. And my political, I told about my bias. I think to discuss about environmental policies, environmental health, we need stability, political stability, political conditions to discuss about that. If you are in instability moments all the time, we don't have policies, we don't have programs. We are always thinking about, okay, I don't know what we do, and this is not a talk. This is not a subject in a society that is under democracy threats. So Amartya Sen say that it's harder to find hunger epidemic in democratic societies, because we can say that this is not right. So I think we need some level of stability to talk about environmental, because it's not a priority in general. It's not a priority for governments. And autonomy of institutions, and in Brazil, we lived there when we had some institutions not so strong, not so receiving support from governments. So, and the first institutions and agencies, public agencies, are the environmental agencies. It's really easier to break these agencies. So I think we need to talk more about autonomy, intersectorality, but also about autonomy. That. Thank you.
Great. Do you have any comments, questions? You want to address?
I can. Well, my name is Mayana, and first, why apologize, because I'm planning to stay away, and I'm shy. But I have started my studies about climate change and effects health, and I can see many challenges about it, and learning to do and see nice presentations help me. And wait, yes, it's kind of
Is there any questions from YouTube audience?
So you saw about the soul.
Yeah. So, I don't have a question, more or less a question. Yeah, she had to explain. Yeah. I'm very glad that this, the way this representation is more, because it kind of showed that shown that we have some problems that we share, and maybe we have some different solutions to address these problems or challenges, as we decided to call this workshop. So I'm very glad for that, because this also brings opportunities for innovation. That's the idea of these workshops. How we set the landmarks to increase our collaboration. So in this sense, I think that we were very fortunate. The more or less question is mainly from Joy from this presentation. One of the problems that we shared from some of the informal settlements that here we call zones or actually favelas. Nowadays, you have this political more friendly term that is communities. That is, I think, it's a kind of statement. But from the environmental justice point of view, I think these are the most affected population in the city. The ones that is more vulnerable because health services and all these sanitation issues that Shannon talked about, it's absent there. So at the same time, they are the more deprived population in terms of social service and also wealth. So this is I think this the one point that maybe we can learn from it, because here again it's very difficult to assess this territory most of the time, because in many cases, if not all, this heavily by truck dealers and some other issues. But they are most vulnerable because of what I said before, and because the health service is not there. We try, but it's not as effective as other parts of the city. And I think that that's reflection of this inequality, not only health inequality, but inequality as a whole in cities, mostly in the global south. So that's why I think this south collaboration is a great opportunity for all of us, because as you said, this relationship with the north, usually they come, get the data, and publish the paper and go home. So I don't know if you could maybe comment a bit more. How you perceive this? How do you think we could be, because you could put relationship in terms of environmental epidemiology in this territory, CG territories?
Yeah, it's in our communities, we have normally what we do is we have to find someone like who lives in the area who are in charge. You have to have trust with them first, then because then they can walk with you in there. In some areas, I don't go alone. We arrange with people who are living there, and then we walk with them. You cannot just simply go in those places alone. Yeah, so normally we have community health workers who are working in the area, and if we have a project there, we work with them. Even in rural areas, you have to employ the locals. You cannot come as an outsider to research them. So introduce yourself to the local people, the local leaders. They tell you you must work with so and so and so, and they work with the industries. Because if you are alone, it's not safe. You cannot do research yourself, and you are not safe. So we don't normally go, even when we go with students, we arrange with the local people in rural areas. And then local people work with us in those areas. Otherwise, it's very difficult. You cannot, yeah. And they know everybody. So when you walk in the street, they'll say, yeah, we are doing research here, fill in the form, you know, or yes, we put this thing in your house, we are doing this and this. We are measuring temperature, and oh, okay, you watch it too. And then, yeah, the ones that live there, if they're community health workers, obviously, then they will get some pay from the university for their stipend, their hours that they work on the project.
How are the service organized there? Yeah, they have system in Brazil. You have universal house system, and it's costly because you have several, clinical, family, clinical, and team, and you have the territory, and you have to sometimes and the same 100% cover the population, but there. How important is that?
Health services is community in South Africa, right? For but there's district clinics and the local, but they are also depending on where they live. They're not everywhere. Sometimes people have to catch a taxi to go to the clinic.
Okay.
That's your local clinic. And then for we have it's a district, it's a local clinic, and there's a district for much more complicated health problems, and then you have a tertiary hospital. So for cases that are complex, then they will have to transfer to a tertiary hospital, which is much bigger.
But it's open for.
It's open for everyone.
To an extent.
To an extent.
But it's not.
But it's not we have governments and we also have privates. So those who have medical aid, like us who work, we go to private. which the services differ.
Yes.
Because the government is.
Also,
Yeah, it's different, but here, 17% is the universal system. And the universal system on surveillance services and primary care and hospitalization and different diagnosis.
and actually some health issues that are treated in the public.
But on us, it's vice versa, because more complex stuff, just better offer in private, and it's expensive. Then, but if I have a medical aid, then the medical aid will cover it, then I pay.
I think here, I don't know there, but here the private sector is very safer in some regions. So here in Southeast, São Paulo, Rio de Janeiro, the coastal region is easier having the private sector access. But in rural regions and the most of the country is in small cities.
Yes, same with us.
So in these cities is the dependence of the public sector is higher.
Same. Private are mostly in urban area, big cities. Rural, not so.
I have one more comment slash question, mostly question this one. There is a lot of pressure from most of the industry in order to shift the energy matrix from fossil fuels to some renewable or even more general cleaner energy matrix. I think the major player in this shift is the transportation, replacing these fossil fuels engines by electric ones. I particularly see this very difficult to implement in some countries, even in Brazil. I do see this going forward in South Africa with this energy shortage that because the pressure is too high.
Yeah.
A lot of pressure from most of the industry.
So currently what's happening now is we're using a mixture currently now. So it's a mixture of traditional sources. So coal, nuclear to a small extent. I mean, I think it's an ongoing conversation. There's a safety issue. There's a whole lot of other issues involved in the conversation. But we are trying to make that move. I think the one thing also need to bear in mind is that certain communities around these coal mines are dependent on the mine for their survival. So moving away from that industry is not just, there are other complications there too. So if you are, yes, you are solving a lot of the issues around respiratory health, around just contamination of the environment. But if you're moving someone from their livelihood, are you giving them or putting them in a position to still support themselves somehow? So I think that conversation is still taking place. We're part of a discussion about if you're talking about this mixture, what ratio is it? We can't fully move away from coal bed. We just completed a coal power plant recently. It's supposed to be decommissioned, but it's now going to last from 17 years or something like that. So one of our provinces is the highest concentration of power plants in that even there. So I don't think it will happen soon. That's the first thing. The second thing, the hybrid cars are not that popular in South Africa yet. I think we have other issues that are much larger than one. We have lots of road traffic is increasing, commercial trucks, for example. But again, something like the railway system that used to be very effective, it's not as effective as it was. So to me, taking the trucks off the road, putting them back to the railway. That's a start. You're already moving your road traffic kilometers. Then you're starting it with this mix between coal, between nuclear energy, between wind power, solar, for example. Once you get that mix right, you get started moving away from fossil fuels. We're seeing most of the big companies, the shopping malls, they're all having solar power now, putting solar panels on their roofs, trying to move away, trying to keep it to the grid. I think the private sector is coming slowly but surely. I think maybe in the next 5 or 10 years, I think we can revisit that conversation to see how far we've come away from some fuels. But for now, I think we're still really in that. Especially we're seeing now lots of new construction of housing. It's at a tremendous rate. We have new housing complexes popping up everywhere. But they are now the ecosystem is very stressed. That's really now start having all of these issues. Okay, so getting them to start. Everyone needs to talk together to find it.
We also have the labor unions, and they often form very close alliance for something happen. So if that's politics.
That's very big.
Yeah, so it's a lot of negotiations and just close a line, a coal or a coal power plant. But the unionists are also, so it's very political as well, it's just transition.
When between sources, so the safe alternatives are necessarily affordable for the wider population. It's great to have solar power, for example, but can you actually afford to buy first place that generation now? Right. So yes, the majority of the users are actually the ones that can buy afford this technology. The ones who don't use a lot, they all now have solar panels and one implant, but there's one person to people in the thing. Whereas in the house where there's 10 people, you can't afford that. So I think there's a long way to go just to get that social perspective.
Quick question about migration. Both of you talked about migration, and many Mozambique, Zimbabwe. How this migration happens? There is surveillance and kind of surveillance, or it's I can't walk. Because walk and I don't see his passport. And well, I think it's about health issues.
So we're doing a study right now. So the area, one of the areas that I showed. So you can literally there's a river that separates the two countries, and very often you have farms. So it's either a citrus farm or a tomato farm that is sort of on the border. And what often happens is the farmer would go in the morning and you would halfway and you would walk across the border and then work for the day or the week. And it's actually one specific study site where undocumented migrant workers were there. So as part of some of the screening we're doing, actually tested that they're not going to be treated because they're not documented, so they're not going to seek healthcare in the first place because you can't produce any kind. So they'd rather not go and get sick and then have complications. Then they go back home. The case is reported in their country, but technically it's supposed to be reported in our country, but they can't. So we have those types of issues too. So there are some clinics that will allow you to come in just to do a test, for example. If it is possible to treat you without wanting to know everything else. So we can do a few of those. Also, our neighbors. Because of the issues they also have, they must be will come to South Africa, trying to make a living. But there are official closely noted, but it's fairly easy to cross. It's not people, but it's really easy. The dangerous one is actually the national park, where the Mozambique is about actually goes through the national park. And you have a lot of cases where the wildlife doesn't go out, like they get eaten by the wildlife. So, but it's a risk level. So those are the type of issues that we're dealing with. So there was a collaboration between these three understand that order to actually talk about these types of things. But again, if an input from one country is higher than the input from other country, there is a problem system. So,
Have some issues, similar issues, some borders, that is just take a vote. Yeah, and go.
there's not much.
And we have laws, we don't know, undocumented. But I think the policy they use in terms of fighting, I guess it's just fighting for resources. If we are equally poor, then there'll always be clashes amongst people.
We find this very, minors that are legal money that is, migrating to,
Yeah.
the border, southern border.
Same home. Now we have a problem with illegal mining as well. They went and opened them old mine shafts. Now people are going underground, very unsafe, because there's still gold from maybe 20 years old. I don't know how much gold they can, but it's a big problem around Johannesburg. Because that's where the gold was first discovered.
Several infections is.
Yeah.
We can share. But
Anyone else? Guys, thank you very much for being here, sharing. We have this meeting tomorrow, so we can. I think this workshop, I hope this workshop is the first of many. Maybe after next meeting, we end So, great. Janine left already, so we can stop.